I'm Kirsten DeWitt, and I'm the Principal Investigator of the Falls Decision Rule Validation Study. This is the training module for emergency physicians. The Falls Decision Rule Validation Study is funded by the Canadian Institutes for Health Research and is sponsored by Queen's University. 3% of emergency department visits in Canada are from older adults who present after a fall. And 80% of all cases of intracranial bleeding amongst older adults is caused by falling on level ground. A few years ago, our team developed the Falls Decision Rule. The Falls Decision Rule determines whether a head CT scan is needed to diagnose intracranial bleeding after a fall on level ground for patients aged 65 years and older. There are 4 components of the Falls Decision Rule. No head CT scan is needed if there has definitely been no head injury on the fall, the patient remembers the fall, there is no neurological deficit that is new when you perform your physical examination, and the patient needs no help for activities including finance, driving, and housework. The Falls Decision Rule has a sensitivity of 98.6%. A negative Falls Decision Rule excludes intracranial bleed with 99.8% certainty. The specificity of the Falls Decision Rule is 20.3%, meaning that almost 80% of older adults who fall and are assessed using the Falls Decision Rule end up having a head CT scan. The aims of this validation study are 1. To report the 30-day failure rate of the Falls Decision Rule, 2. To report the proportion who test negative with the Falls Decision Rule, and 3. To report both the 30-day failure rate and the efficiency of the Focused Falls Rule. The Focused Falls Rule has only 2 items: whether the patient hit their head when they fell and whether they have any new neurological deficit on physical examination. The Focused Falls Rule has a sensitivity that is a little lower at 95%, but a higher specificity of 38%. For this validation study, we will enroll 4,000 patients. Eligible patients are aged 65 or older, presenting to the emergency department after a fall on level ground or a fall from their bed, a chair, or toilet seat. So what does study participation mean for you? To be included in this study, the patient's physician must document the Falls Decision Rule items either in a dot phrase or in a hard copy study form. This is a screenshot of the dot phrase that we use in my own hospital. There are 6 items that all patients must have completed in order to be enrolled in the study. The physician must document whether the patient's GCS is normal for them or reduced from baseline, and they must document whether there is or is not a bruise or laceration on the head. The first item in the Falls Decision Rule is whether there was a head injury on the fall according to the patient, according to a witness, or your physical examination. The options are yes, unclear, or no. The second item is amnesia of the fall according to the patient with the same options of yes, unclear, or no. Next, you document whether there is a new neurological abnormality on your examination and whether the patient needs help for managing their finances, cleaning their home, driving, or any other daily activity, with response options of yes and no. The Falls Decision Rule is positive if you've responded yes or unclear to any of those 4 items, in which case a head CT scan is recommended to exclude intracranial bleeding. The falls decision rule is negative when all 4 items have a response of no. If the falls decision rule is negative, but you decide to order a CT scan anyway, we need you to document the reason why. In this case, the options are rule out stroke, delirium workup, or other. For the patient to be enrolled in this study, documentation of these items must occur during or at the end of your shift. You must document the falls decision rule whether it is positive or negative. The primary outcome of this validation study is the decision rule's safety, and the safety is calculated among the patients who have a negative falls decision rule. We anticipate that around 1 in every 5 patients will have a negative falls decision rule, so it's very important that you don't forget to document the falls decision rule even when it is negative. We encourage you to use the falls decision rule to determine whether a brain CT is necessary for your patient to rule out intracranial bleeding, although we realise there may be many other reasons to order a head CT. Participation in this study means not missing any cases of falls in patients aged 65 or older who you treat. If you're a staff physician, it also means documenting the falls decision rule items for patients who your resident treats. We advise documenting these items when you sign off on the residence chart. To summarise, participation in this study means recording 6 study variables on all patients aged 65 years or older presenting after a fall. You will record the 6 study variables during your shift, and you will record them whether the patient was seen by you or a resident who is working directly under your supervision. See your site investigator to determine whether you'll be using a dot phrase or a hard copy study form. You'll record the 6 study variables, whether or not the falls decision rule is positive or negative. Ideally, you'll use the falls decision rule to determine whether to order a head CT scan to exclude intracranial bleeding. In the event that you order a head CT scan when the falls decision rule is negative, we ask you to record the reason why. The falls decision rule was derived in over 4,000 older adults presenting with a fall to emergency departments in Canada and the US. You can read the original study in the CMAJ published in 2023. For more questions, reach out to your local site investigator. Thank you. That brings us to the end of your training.